Multiple new studies have found that strokes from blood clots and brain bleeds are on the rise, especially amongst younger or middle-aged men, and especially amongst African Americans. So what can you do to help? Well, joining us this morning is Dr. Ketan Trivedi, a cardiologist with Virginia Heart Medical Practice, with some tips on how to prevent stroke. I appreciate you joining us this morning. I mean, this is a very important topic. A lot of times people would think that a stroke is something that happened to their parents or maybe their grandparents. But and we saw Luke Perry at 52 have a stroke, and I think that woke up a lot of people thinking maybe this could happen to me.
No, I think you're absolutely right. It's a really important issue. We know that there are certain factors that young people can have that can increase their risk of stroke. Things like having blood that clots too easily or certain cardiac abnormalities like a hole in your heart. But the reality of it is most of the risk factors for stroke in young people are the same as those for older people. So things like high blood pressure and diabetes, smoking, high cholesterol, those apply to both groups. But there's this perception amongst young people that this is something that happens to the older folks. It can't happen to me. It can happen. When it does, it can be catastrophic. I was just in the hospital last week, and in 1 hour, I saw 2 young people who came in with huge strokes. Both of them had had high blood pressure and had no idea.
And that's my question, because obviously, you know, a lot of times perception is based on at least some type of reality, right? Is it just that younger people are getting it now? Are we not taking care of ourselves as we used to do? Why is it that it seems to be changing a little bit? Or is it just it's getting more attention these days?
I think it's a little bit of all of the above. I think the African American population in particular is really susceptible to this. Those 2 people I was telling you about, both were young black men. And I think there's several things going on here. One is that high blood pressure is super common in that population. About 67 million Americans have high blood pressure, and black Americans, black males in particular, have the highest rate. It's also asymptomatic in a lot of people. And also, sadly, in 2022, we know that black Americans don't have the same access to health care as their white counterparts. So it's a bad combination.
We have, unfortunately, here in the D.C. area, one of the higher rates of diabetes also. Does that play in line with the risk for stroke?
Absolutely, it does. Diabetes is hugely important. And this is where things like knowing your numbers is really important. So knowing your blood pressure, knowing your cholesterol. If you're diabetic, knowing your blood sugars and your A1C, those are super important, because we know that treating those things actually reduces the risk of having stroke.
All right, so aside from perhaps a diabetic who might already be tracking their numbers, you did mention a lot of the cases it's asymptomatic. So where do you start to make sure that you're not the next statistic?
Probably the biggest thing you can do is check your blood pressure. You know, this is something that you can just do at home. You don't need a lot of fancy equipment or training. You can buy a blood pressure cuff from the grocery store, the drugstore. You put this thing around your arm, you push a button, and it gives you a blood pressure. And if you're seeing numbers above about 130/80, show those to your doctor. Say, hey, this is what I'm getting at home. Let's talk about this.
A lot of times, you know, some people will say, hey, you can do this for free, maybe at the local drugstore. Are those accurate, or should you get a different type of device?
Yeah, you're never quite sure. You don't know if some kid's been playing around with it or not. So it's probably better to get your own device and check it on your own.
All right. Now, this is not all a hopeless scenario. There are ways, especially for the younger population, to perhaps maybe make some lifestyle changes to ensure that they do not become the next person who is a victim of the stroke. What's the best thing to do?
Absolutely. We talked about knowing your numbers, treating those numbers, a heart-healthy lifestyle, so diet that's low in sodium, restricting your alcohol intake, those things are important. And we know that tobacco and cardiovascular disease and stroke go together, so whatever you do, don't smoke.
Is it the kind of thing, because you know, you mentioned some of the, obviously, the heart issues. If it's a lifestyle scenario, is that the kind of thing that, does it take a lifetime to change that? If you change your living environment or your intake of whether it be you know, alcohol, smoking type thing, or is it, can you make a pretty abrupt change?
You can make pretty abrupt changes. I mean, you know, it's never too late. And these are things that are simple to do. They're not expensive. Changing your lifestyle is something that everybody can and should try to do. Take a good look at how you live your life. And it is never too late. Anything you do now can have impact. It doesn't take 20 years to see those impacts. You can see it pretty quickly.
Well, I appreciate you joining us. It's certainly a very important topic, and we'll put some tips online as well. But I think you just gave some of the best ones right there. If you go to virginiaheart.com, of course, you can find all the information that you need to know. Thanks, Doctor. Appreciate you joining us this morning.
Thank you for having me.
All right.